Dear viewers, welcome you all to our show, OSA, that is Orthopedic Solution Academy. Dear viewers, today our topic is osteosynthesis, according to Ilizarov, in foot surgery. And the speaker is the highly academician, Professor Novikov sir from Kurgan, Russia. Dear viewers, we have three learned academic experts with us. One of them is the legendary Ilizarov surgeon from Bangladesh, Professor Mofakrul Bari sir. Another one is very enthusiastic, Dr. Shamsul Huda sir from Patna, India. And the other one is Dr. Omar sir from Kurdistan, Iran. Dear viewers, we will go to our presentation directly as because of some sort of networking problem is there in Russia. We all know about that. So hope you are joining with us in the coming part of our program. And I would like to request our honorable speaker to start his presentation. Professor Novikov, sir, would you please start your presentation?
Okay.
Good afternoon. Good afternoon, dear colleagues.
Good afternoon.
Good afternoon, sir.
Today I want to show our experience on the treatment on the foot. Our center has 22 departments, and one department is special treat only foot problem. And this is material give me Dr. Danilkin, and he has near 35 years experience in our center. Few years he worked with Professor Ilizarov, and all of life he spent for the foot, and very strange for hand problem. And today in our area we have excellent weather. Our spring at night time was minus 25. Now during the day we have minus 5. Excellent weather. And the prevalence of foot pathology, according to the World Health Organization, foot deformity occurs in 12 of patients with congenital pathology.
Slide.
More than 10. Pardon?
Slide. You move your slide.
And just now you cannot see?
We can see only one, but it is not moving.
Они не двигаются. Вот так.
Yes.
And now?
Yes.
Just now everything is good?
Good. Давай.
Yeah. I will not change anything.
Okay.
And of the number of patients with disorders of musculoskeletal system, foot disease according more than 25 and near the 30%. And why we use Ilizarov methods? And this is Ilizarov principles true of principle of foot department, because Ilizarov method, this is minor invasive of surgical intervention, stability of fixation of bone fragments, the possibility to early functional loading on the operated limbs, and then possibility of controlled doesn't movement of bone fragments, and the possibility of adjustment. The techniques use the various stages of fragments based on the emerging clinical situation. I am not little bit, this is not my C on this problem, but surgeon from foot department want a special show basic principles for the foot of Ilizarov methods. And before treatment patients with foot problem, we examination and disease of the foot, like clinical examinations, X-ray examinations, and physiological research methods, including podography. And this is very important examinations because we can control position of the foot during the treatment and after treatment. Indications for surgery. This is accurate and congenital deformities, shortening, and anomalies in the development on the feet. But so many contraindications, like several general somatic conditions of the patients, mental disorders, angiotrophic and neurological disorders, infections, lesions of the tissue, of the segments, of the extremities, and adjacent joints. And for surgery on the foot, we don't need so many details from apparatus. Only arch, few plates, few hinges, and washers, and obligatory wires. This is scheme of fixations. Before surgery on the foot, we need pass wire on the tibia. And some doctor use only one ring on the tibia, but so many doctor use for stability, stable fixation of basic frame on the tibia. Better if we will put two rings on the tibia. Not often, but sometimes. Sometimes we have situation when we need to rotate not tibia or not foot, tibia, because problem not come alone. Usually we have situation when with deformity of the foot we have some problems with deformity on the tibia. Without osteotomy on the child, we can derotate with a simple system when we can put on the tibia. Scheme how we can pass wire to the calcaneus through the talus. And last few years, doctor prefer pass through the calcaneus console wires. But when we pass console wire, this is not enough too. Usually doctor pass 4 or 5 console wires. On this scheme, you can see how we can pass, but now, please, I am not change slides from the Dr. Danilkin, but I want to ask you, this slide is correct? This is possible, pass wire through first and through all of wires till fifth bones and another. I think this is not so correct picture. What do you think about that? This is my questions for all of you. Then foot, this is segment when doctor needs zinc. So many hinges, so many plates, so many deformities we need correct. And you can see, without frame on the foot, we cannot change position of the foot. And better if we will have 2 frame on the tibia. And then on the final position, when we finished, usually we remove all of, how I can say, job roads from the apparatus, and all of these rods we put inside of our apparatus. And usually together with deformity on the bone, sometimes, not sometimes, very often, doctor need to do surgery on the soft tissue, and like surgical intervention on the soft tissue with osteotomy of the bone on the foot, stabilization operations. On the soft tissue, usually most of patients we did achillotomy, tenotomy, lengthening or shortening tendons, tenodesis, tendon transplant. So many techniques to the achillotomy, tenotomy on the flexor digitorum brevis tendons on the foot. When we touch bone on the foot, very often we touch talus. And to do osteotomy through neck, through body of talus. Sometimes this is depend of situation. Doctor make special osteotomy through anterior part of talus and calcaneus to correct the excavation of deformity of the foot. Here you can see schemes of performing osteotomy on the dorsal bone. For example, cuboid bone. Here, scaphoid and cuboid bone. Here, cuboid and sphenoid bones. When we have deformity on the foot, sometimes we need to do osteotomy only one bone, but usually doctor make so many osteotomies, multiple bones of the osteotomies. For example, today I have surgery on the femur, and I make only one osteotomy on the femur with patient was with valgus deformity, and near on the second table in operation theater, doctor from this foot department make 5 osteotomies. Very often we make osteotomy like V-shaped of the foot with plant deformity on the foot. I don't know how in the English alphabet, but Russian we can say G, G-образная. In the translated, this is L-shaped osteotomy on the foot. I think after presentation, Dr. Barry will help me with this osteotomy. And this kind of osteotomy very like Professor Shevtsov. And for this osteotomy, he has a special osteotome, so many small osteotome, big osteotome, especially for this articulated osteotomy of the foot. And each week, few patients, we did panarthrodesis. Some patients need arthrodesis of subtalar joint, ankle joint arthrodesis, and 3-joint arthrodesis. And for that, you need invite doctor with big experience, because so difficult for everything. And for example, how we can start from osteosynthesis or from arthrodesis, and we need learn everything with doctor who many years use this osteotomy. Stabilizing operations. Sometimes we did this. And let me show a few clinical examples. Like first patient, this is congenital bilateral club foot. And during the treatment with apparatus, we correct all of part of deformities. This is congenital, recurrent left side club foot, and during the treatments with Ilizarov frame and ductor fixation with console wire all of finger, and this is final result. And usually our patients can walk with apparatus. In other patients, 22 years, congenital club foot, 4-degree, shortening of the lower legs, 3 centimeters. Simultaneous with correction of deformity on the foot, doctors can lengthening and remove discrepancy of the tibia. And like all of patients, during the treatment, obligatory, all of our patients go to the gym and make exercise and weight bearing. In other patients, Charcot disease, equinus deformity, step by step, not in one day, but with interval of a few weeks, operate both of feet, both of tibia, and then get result, I think, fantastic result with correction with all of deformity on the foot. And very interesting and separate area on the problem on the foot, elongations, short bones on the foot. And we can length one or few bones. And here you can see 2. And usually for that we use mini fixator, original mini fixator. Very funny, but very effective. Simultaneous metatarsal and midfoot lengthening. Difficult, but possible. And here you can fix all of ray with console wire, because very big amount for lengthening and soft tissue without protection of the olive ray will go to the bent contraction on sometimes for luxation of the finger. For that, we need pass wire through the finger. And like now, sometimes we have another problems like defect, and simultaneous with lengthening, we can treat defect of short bone. Here, elimination of valgus deformity on the first finger. Just now, so many techniques, but here with mini Ilizarov device, we can too support of this patient. Or another, with anomaly of in development of the feet, with hypoplasia, metatarsal bones, we can length of this bone. Like here, you can see third and fourth ray doctor make lengthening, excellent lengthening. In the Asia, this is very common. And here, congenital malformation on the left foot with hypoplasia of the first, third, and fourth metatarsal bone shortening on the foot, more than 3 centimeters. And for this kind of apparatus, patient needs stay near with doctor. Please not discharge this patient from hospital, because without doctor, patient alone cannot get normal result. Very often, maybe once in a week, maybe more, we need make x-rays, prescribe x-rays, and so many times doctor change so many hinges and metal, but on the final you can see excellent, perfect result. Here patients, in other patients with bilateral valgus deformity on the first toe, and with Ilizarov technique, this is women get excellent result. Like on the hand, on the foot, we have syndactyly, and with mini Ilizarov device, we can support of this patient. And like any part of our body, osteosynthesis with Ilizarov frame, Ilizarov device, on the foot, we have a period of active osteosynthesis when a patient needs attention from doctor. And then when we correct all part of deformities, patient can leave from doctor. And when doctor remove frame, coming another very important period when patient need period of functional rehabilitation. And now we have very poor system. I think all of the world haven't good collaboration between surgeon and between rehabilitation physiotherapist. And we need to think together how we can support, because patient don't need second surgery, but patient need excellent rehabilitation for functional, for weight bearing, for find good shoes. And Ilizarov not like plaster cast, but for children we cannot support without plaster bandage or with plastic bandage, because baby is baby, and after removal of frame, we need continued special fixation with correction on the correction position on the foot. Doctor, give me this slide, Dr. Danilkin, because this is complications possible, not of all of patients, not often, but this is possible, like inflammation of the soft tissue at the pins on area on the wire, because I think eruption on the skin and bones, this is same inflammations, like we can talk like problem on the soft tissue. Hemodynamic disorders. These complications, I won't say all time in the hand of surgeon, because hemodynamic we can control it, and if some problem with blood supply come, we can change our frame and can very easy go out of this problem. Contracture of the joint on the toes. This is very dangerous complications, because doctor want lengthening and sometimes not controlate position of the of the adjustment joints. And in the past we have so often situation when we have dislocations on the joints. Thank you, dear colleagues, for your time, because Friday is Friday, and you sit and with us. I hope you get some small information which you can use in your job. I am happy because so many years, each morning time, each evening time, I say some words for my father, for our teacher, Professor Ilizarov. I go near this monument, and I think this is simple word, Ilizarov, will be forever, because for us, this is man give us wings, and just now all of us can fly. This is true, we can fly under all of difficulties and complications. And I hope Russia will great, Ilizarov already great, and we can collaborate more and more for benefit of our patients. Thank you very much. Спасибо большое. And I want to invite you for the Russia, for Ilizarov readings, and for Mecca of Orthopedia. Thank you, dear colleagues.
Thank you very much, sir, for your excellent presentation. And that was a highly informative presentation for all of us. Now, I would like to request Professor Mafakrul Bari, sir.
Да, спасибо. Очень хорошо. Очень хороший доклад. Да, слишком было.
Спасибо, Барри. Я не слышу, я только тебя слышу.
Хорошо, окей.
Now, I would like to request Professor Mafakrul Bari, sir, to share his experience regarding the presentation. Professor Mafakrul Bari, sir, would you please?
Novikov. Слышно сейчас? Can you hear me?
Как с телефона?
Oh, he cannot hear me.
No, sir. Sir, please continue, sir. Yes, sir.
So, listen. See, the information was given by Professor Novikov, is a fantastic Fantastic
Слушай, а может
information.
быть где-то здесь у меня этот
So,
не работает?
Studio, please mute everyone except Professor Barisar. Studio, please mute everyone except Professor Barisar.
see, the osteosynthesis in foot surgery is a very big chapter, very big chapter. If you think about the diseases, there are a lot of diseases, 28 bones in your foot, and every bone has his specialty to go for surgery in the foot. He has shown the CTV, how to correct, how to do the osteotomy in the talus, in the calcaneum, V osteotomy, U osteotomy, and L or gay, that is gay in Russian, there is L type osteotomy. There are varieties of osteotomies in the foot. You know, I am doing a lot of foot cases. Recently, this is my bitter experience. One patient that was seen by our Shamsuruda, young lady, came to my place, and when I started lengthening of the foot, she told me, "Sir, I don't want to go for any lengthening." And this is my bitter experience in my life. I have done a lot of cases, and I had to stop that one because without knowing her husband and father, she came to me with mother. This is the reason, and that was hidden by them. And she came to me. This is my bitter experience in my life. When she started to for surgery, I told, why is your father? Father doesn't need. You do surgery. After 10 days, so no, why lengthening? I don't want too much lengthening. This is the happen. So before going surgery, you must counsel your patient. And the cases that he has shown, fantastic. Original Ilizarov, Kurgan, Patan cases. Only the wires, by using the wires, you can do lengthening, you can do any kind of deformity correction in the talus, in the calcaneum, in the foot. That is fantastic. So this is a very good. Danilkin, I know him very well. He's working in the foot surgery department, and a lot of American, British, Japanese, and Koreans, they are coming to learn this foot surgery in the Kurgan Center. Thank you very much. Thank you, Dr. Novikov. Although he's not listening, we listened his voice, but not now. He's not listening anything and not seeing our face. Thank you very much. And it was an informative lecture. Thank you very much again.
Thank you very much, sir. Now, I would like to request Professor Amur sir to say something regarding the presentation. Professor Amur sir, can you hear me, sir? Please.
Was fantastic presentation, but really we have some problems sometimes, especially in case of clubfoot. If it is unilateral, after complete plantigrade of the clubfoot, the size of the foot is smaller than the other. So the patient has difficulty in shoe wearing of two different sizes. Obligatory, sometimes we are doing elongation of the foot, but as you know that patient selection and patient satisfaction is very important 2 points when you are doing such kind of surgery. Thank you so much.
Thank you very much, sir. Now, I'd like to request Dr. Shamsul sir to say something and share his knowledge regarding the presentation, sir, please.
Yeah, can you hear me?
Yes, sir. We can hear you, sir.
Yes, thank you. Thanks, Dr. Tanvir. I'd like to thank Dr. Novikov for our wonderful presentation and lots of teaching. And it's very true that you must get a very well training in the Ilizarov for correcting very minute deformities, and you can get beautiful correction as a natural. And we have seen, as Omar has said, that after correcting first the deformed foot, we see that sometimes there is the foot is small, or even there is some residual deformity in the other foot also. So it's very important to keep a balance between both foot so that they look cosmetically similar. So learning is life. We learn throughout life, and thanks a lot.
Thank you very much, sir, for sharing your knowledge. Professor Barisar, can you hear me, sir?
And yes, I'd like to continue that, as Barisar said, proper consent is very important. That patient from Bangladesh contacted me, and I referred to Barisar, and she was very irritated patient. She stopped the treatment in between. It's very important to get the proper consent from the guardian also. Yes,
sir. Sir, I have a question. Yes, sir. Professor Barisar, I have a question. As Professor Novikov sir mentioned in his lecture that the wire insertion of the metatarsal bone, the cross wire, he don't encourage that insertion of wires. He encourages console wires, and he encourages to put every wires in every metatarsal bone. What is your comment about this?
It depends, it depends on case to case. It it varies case to case. Whenever you are going to correct the cavus, then you should have to put the wires in the fifth one and the first one. Then you can gradually correct the cavus of the foot. Regarding the console wires, when you are lengthening for simple disease metatarsal bone, you should have to go for the console wires from both sides and bending it 45 degree, and you can fix that one with mini Ilizarov fixator. And whenever you will see the cases, by looking the external views, you'll not be able to full understand how to correct all these things. So that's why basic Ilizarov course in foot surgery should have to go. Then you will be able to understand how to correct all kinds of deformities in the hind foot, mid foot, forefoot, adductors, varus, cavus, equinus. There are lots of deformities in the foot. Even then, I am doing, you believe it me, that I am doing the hallux valgus. Very simple operation with Ilizarov fixator. Hallux valgus. Very simple operation. You can correct by Ilizarov apparatus. Even then, if you don't want to put the Ilizarov, you can correct with these small screws. It's better to go for Ilizarov. I have a comparative study with the screws and the Ilizarov. Ilizarov gives better option. Only one bow or two bows, and you do the distal osteotomy. Just deviate the distal one and medialization, lateralization. This is very easy. Put one guide wire inside, and you can fix it with the bow. So by these hallux valgus, hallux varus also you can correct with Ilizarov apparatus. Professor Shevtsov has got a very fantastic book on Ilizarov in the foot surgery. Very beautiful. You don't have lower end of the tibia. You don't have calcaneus. You don't have talus. You can make calcaneus. You can make talus, and so that the patient can walk with his weight-bearing foot. So this book is very fantastic. I know the Omar Baravi, you have got that book. Yes, fantastic book. Whenever I need, I see that one. Fantastic book written in Russian. But if you don't do Russian, even then if you look at the picture, you will have an idea how to go for surgery. Beautiful. You can make calcaneum. You can make talus. You could make metatarsal bone. Fantastic book. Only one book in the world on foot surgery. What I have seen in Kurgan, lots of foreigners, British Americans, Japanese and Koreans, they are particularly going to the foot department to learn the foot surgery. Am I correct, Novikov? Correct. Okay, thank you.
Yes, sir. Thank you. Thank you very much, sir. Hope we'll get the book in the PDF form. Then we can circulate this book to all of our young surgeons so that they can learn from that book also. In the coming future, we will arrange that books in a PDF form from Orthopedic Solution Academy. Just wait. And thank you very much, our honorable academic expert and our very magnificent speaker for his presentation. And dear viewers, we will connect you in the coming Friday with another magical Ilizarov topic. Till then, I am Dr. Mohd Tanvir Ashok saying bye-bye to all of you. And before ending our program, I would like to thank Rajtv for helping us to arrange this type of academic program, and definitely Renato Pharmaceuticals Bangladesh Limited for sponsoring our program. Dear viewers, hope you will connect in the coming Friday with another magical Ilizarov topic. Till then, I would like to say bye-bye. Bye-bye.
Okay. Bye-bye.
You are watching Rajtv, Jagorone, Bangladesh. Please subscribe.